we have had a sensitization session with the governors and the Council of Governors, and we are in agreement that now we go and start the rollout of universal health coverage, which was the promise that His Excellency the President gave. So we are good to go from here, and the ministry is ready. We start rollout in annex. But I also want to thank the governors that finally we have now executed the IPS, and that moving forward, the noise that has been around on the medical managed equipment services, that has been put to an end. And as a ministry, we have been given the mandate by the governors to proceed and get into service level agreements that shall ensure that services are provided at the county facilities. Thank you very much.
I want to thank the ministry today for the engagement we've had. Today we've witnessed the death of MES, or the MES, and we have now a new scheme called NESC, which is the National Equipment Support to Counties by the national government, which we have varied history on how the MES was consumed, or rather consummated. We are now on a new level where our interest is the service to the people, as long as the national government is providing the equipment. And we are convinced beyond any reasonable doubts that we have done the right decision. That is why we have signed today, because we need the equipment irrespective of the model of engagement with the vendors. Because as counties, as we are consumers, the agreement between the national government and the vendors is something they have already put in place, and they're satisfied that it is a good relationship. Otherwise, they would not have had us to sign the agreements today. Thank you very much.
The Council of Governors, together with its partners, convened a 2-day consultative meeting between the national government and the county governments to review the intergovernmental relations and engagements between 2 levels of government, with a critical focus on health and social protection sectors. The forum brought together governors, the leadership of the Ministry of Health, led by the CS Nakumicha, Ministry of Labor and Social Protection, County Executive Committee members in charge of health, and development partners. The purpose of the meeting was 1, to strengthen health sector-specific intergovernmental collaboration and address emerging issues which include community health promoters, operationalize of primary health care networks, sustainability of UHC medical equipment and related services deployed by the national government in counties, NHIF reforms, amongst others. To enhance a greater common understanding of social protection by both levels of government, this includes the role of county governments in social protection, financing social protection interventions, and opportunities for county government in the social protection ecosystem. And 3, to receive updates on the just concluded exercise of unbundling functions. To this end, we will address you on the resolutions from the meeting. Resolutions on county health promoters, CHPs, that the 2 levels of government to jointly facilitate the payment of stipends to CHPs. Additionally, the community promoters will be provided with a kit that will enhance medical response at the community level. The actors is the county governments and the Ministry of Health. Number 2, that the Ministry of Health shall replenish the kits after every 3 years. The actor, the Ministry of Health. On primary care networks, PCNs, that the PCN model has been agreed upon by the COG and the Ministry of Health. However, the financing model will be agreed upon by the 2 levels of government. The actors is Council of Governors, Ministry of Health, and National Treasury. Number 4, that a joint facility assessment to be undertaken across the country to inform the number of primary networks to be established. The actors is the County of Governments and the Ministry of Health. On health financing, number 5, that the National Health Insurance Fund will be reformed to a social health insurance fund through the process of stakeholder engagement. The actors, county governments, Ministry of Health, and NHIF. Number 6, that the funding for level 1 and 2 and 3 facilities will be financed through a public finance mechanism and individual capitation. Level 4 and 5 hospitals will be financed through social health insurance. Further, level 6 will be financed through a critical illness fund and social health insurance. The actors, Ministry of Health, NHIF, and county governments. on medical equipment and related services deployed by the national government in counties. Number 7, that all pending issues on medical equipment and related services deployed by the national government in counties have been agreed upon by the 2 levels of government. Intergovernmental participation agreements, IPAs, have been executed between the Ministry of Health and individual county governments. Those county governments that are not here, the CECs have taken their IPAs, and we expect that they will be back in a maximum 2 weeks. But the county governments that were represented here today have signed the IPAs. On Facility Improvement Financing Fund, FIF, number 8, that the model be developed by the Council of Governors, Ministry of Health, and health policy stakeholders has been passed in 27 counties. It has been agreed that COG will sensitize the remaining 20 county assemblies to fast-track the passage of the bill in the next 2 months at the most. The actors, county governments, and the Ministry of Health. On social protection, number 9, that a technical team comprising of Council of Governors, State Department for Social Protection, UNICEF, WFP, and sector partners shall convene to establish a framework to institutionalize social protection programs at the county level. The actors, Council of Governors, State Department for Social Protection, UNICEF, and WFP.